Shall we go? Beautiful. Morning everyone. Welcome to our weekly update in regards to COVID in the Murrumbidgee Local Health District. The good news is we haven't had another positive case, so the tally of patients with COVID-19 disease in the Murrumbidgee is still at 45, and of those 45 patients, 38 have recovered. There's currently no COVID-19 positive patients in a hospital, and then obviously if there's nobody in hospital, we don't have anybody in ICU. Up till this morning, we've done 3,287 tests, so that's now more than 1% of the population of the Murrumbidgee Local Health District. And we need to thank the community because even with the school holidays, even though we're all at home, we've tested 611 people in the last 7 days, so that's absolutely great. So firstly this morning we really would like to extend our thanks to the community in terms of the support. We know it's difficult. We've changed the way that people can visit hospitals, how they can visit residential aged care facilities, but clearly if we look at the low number of cases, it actually has been worth it. I think it is important to remember though is that the reason why things are so good currently is because of all the things we're doing. And we've seen, just this morning, China, who had things under reasonably good control, one overseas traveller, and they've locked down a province. So sadly, we still have to remain vigilant. Really the basic things, cough etiquette, hand hygiene, social distancing, we have to continue to make sure that we keep our communities safe. Now, people who have visited hospitals would have noticed that there's temperature checking in place in all our facilities now, and that is just one extra measure to try and keep patients, staff and the community safe. Everybody's there just to look after you and to look after your family members. It's something different. Those of you that have seen footage from Singapore, it's common every daycare they check the temperature of children. So, it's just one extra measure that we've implemented with the support of New South Wales Health. So, if you've got any questions for me, now's the time.
So it's been about 3 weeks since we've seen a new case in Murrumbidgee.
Yeah.
The line is flattening. When would you be comfortable and confident to see some restrictions from the hospital's point of view?
Yeah, so if we look at it, we've actually checked this morning. It's been 14 days since we've had the last truly local or Murrumbidgee case. The decision to restrict or reduce restrictions is not up to the local health district. That's determined by the federal government and New South Wales Health, and we will follow their advice as is required. Obviously you would be aware that there is a plan to recommence, very annoying fly now, recommence elective surgery, and we are in the process of developing a plan to make sure that we can treat patients but still make sure that they're kept safe and the community is safe, and then most importantly that we can make sure that we have resources in the form of PPE, critical care beds, other hospital beds available in case there is a second wave. But we pretty much have to follow what the advice is from New South Wales Health, but I do think that there will be a sensible approach in terms of looking at risk in an area and then make decisions.
In terms of the equipment, have you been able to get what you need if there is a sharp incline?
Well, at the moment we have enough equipment and PPE and ICU beds to essentially triple capacity. So we are ready, but as I say, luckily we've only had one patient in intensive care with COVID disease. We've had no ventilated patients, and currently there's no COVID patients in the intensive care unit. But I can assure the community that we are prepared, we are well practiced, and we have what we need to care for them if required. Realistically speaking, for us to plan, it would take at the very, very least 2 weeks, and it would be a gradual process. I think it really is important that I don't think the world will ever be the same post-COVID. I think it's a generation defining event, and what will happen is that it will be done very gradually, because there are a number of factors to consider. The one is the public health component, the other component is equipment, beds, the risk of patients having surgery should they contract COVID. So there are a number of things that we'll take into consideration to make sure that the patients are kept safe, staff are kept safe. Definitely not any significant change in the next 2 weeks. Any other questions? So I'm going to introduce Associate Professor Tara McKenzie, who's a respiratory physician, and she is the COVID physician on for the district this week. And I thought that she could give you an overview of the role and also provide some frontline medical advice to the community of the Murrumbidgee Local Health District. Tara, thank you.